Okay, today we're going to be doing, we'll be listening to the lung and the heart sounds today, and also I'll be doing the tactile fermentus. So the first thing you want to do is when you want to listen to the lungs, anteriorly, you want to start at the subclavicular area, moving side to side in a downward fashion, all the way down to about the 6th rib. What you want to have her do is you want to have the patient lean a little forward. She's going to have to take deep breath in and out of her nose, out of her mouth. Okay. Take a deep breath. Good. And then to listen to the lungs posteriorly, what you want to do is pretty much the same process. You want to start at the subclavicular area, at the apex of the lung. Usually a good point to start is at C7. You want to move from side to side in a downward fashion and laterally, all the way down to T10. When you do the lateral side, you want to make sure you go all the way down to the 7th and 8th rib. Okay, take a deep breath. Thank you. Now for the next part, the tactile fermentus, what you want to have her do is she's going to repeat 99, and then what you want to do is you want to just feel, you can use the palmar base of the fingers, and then you want to just move in a downward fashion. We're going to be doing it anteriorly and posteriorly. Okay.
99, 99, 99, 99. 99,
good.
99, 99, 99, 99, 99, 99, 99, 99.
Good. It's symmetric posteriorly and anteriorly. For the heart sounds, you want to listen to 5 main areas. Excuse me. So what you want to look for is the apical area, the pulmonic area, Erb's point, the tricuspid area, and the mitral valve. So for each point, the apical area, you want to start by finding your landmark. For that one, it would be the 2nd inner space on the right side, and then moving right across would be the pulmonic, which would be on the left side in the 2nd inner space. Erb's point will be just a little below, I would say around the 3rd near the sternum on the left side. Moving from there, Erb's point would be the tricuspid valve. The tricuspid valve would be in the left lower sternal area, probably about the 5th intercostal space. The mitral valve, your landmark would be in the 5th intercostal inner space, mid-clavicular area. So now we're going to be listening to those as I find the landmarks. Okay, if you want to lean forward just a little. And also another point to mention, when you listen for S1, the best part of the anatomy of the heart to listen for that would be at the apex of the heart, and then S2, the best area to listen for that would be at the base of the heart. For S3 and S4, if you hear something and if you want to get a better hearing for it, you will have her lay on her left side and listen for the sounds. You get a better sound. Okay, so we're going to start with, you're going to try to find the 2nd intercostal space, as we mentioned previously, and that will be your landmark. So that will be your aortic. You want to lean forward a little bit. Respirar normal como. Good. And then we're just going to move straight across into the second left intercostal space, and we're going to listen to the pulmonic. Then we're going to, from the second, you're going to find just about the third near the sternum. For the tricuspid, you're going to move to about the fifth inner space on the lower side near the sternal border. So third, fourth, fifth. And then for the mitral, you're going to be about the same area, but you're going to want to move to the mid-clavicular line. Okay, so S1 and S2 are fine. I do not, we can try having her lay on her left side and see if we can listen to an S3 or an S4. And then when you have her lay on her left side, you want to kind of go behind her.
Así como así.
Sí. And listen. Okay, so no S3 and S4 sounds are heard, and that concludes my assessment for the heart and lung. Thank you.